Yes.
Go ahead, question.
Oh, well, so I mean, you're when you put your leg in and foot in there, it can kind of tell what shape you're in at the moment, and kind of judge some things about your current muscle strength and flexibility, and it kind of starts to self-plan out what would be a rehab strategy for her.
Yeah, you're sort of extracting a lot of the really cool talking points too. So I'm really excited that you're doing this. And the short answer is, and I'll of course get to the long answer here in a second. But the short answer is yes. Effectively, it does have, because it has those sensors on boards. It has those bits of data that come from those sensors, inform computational models. These are basically just computer algorithms that try to extract information from that data. They can then sort of condition a rehab program. So yeah, you're exactly right. But let me just put a quick bookmark in that section really quickly. And let me ask one clarifying thing.
Yes.
And I may have misheard you, but it sounded like you said she already had a weakened left arm before this stroke.
She had a stroke, and then she had a fall, and they had to take her off of the Eliquis.
Okay.
The Eliquis brought on a second stroke, which affected her more. I would not say the first stroke was, from kind of the upper body was doing fine. The lower body had some balance issues, but the second one really started to affect some of her locomotion and, unfortunately, body operating.
Sure. No, that's thanks for that clarification, because I wanted to make sure that I fully understood the situation. It's because it's important to know. So that makes a lot of sense. So we can go back to the your original sort of question and your original sort of topics you wanted to discuss. Yeah. So when the Motus Foot works with someone, it has a series of sensors on board that detect things like the forces that are being put out, the ranges of motion, and the measures that can be derived from those kind of first principles, things like precision of movement or how fast you can move, these sorts of things. And all these bits of information help to establish an objective baseline, which is something that you mentioned, right? What is the current status? Because we have to kind of condition a rehab program based upon that baseline, right? We wouldn't want it to be uniform across everyone. That wouldn't be
recording
effective
in progress
or fair for that matter. So that's a really important point, and it does do this. What's interesting too is that it can work not only sort of autonomously, but it can work synchronously with a skilled provider. So if, for instance, you wanted to start using this sooner rather than later, and you did have a home health therapist or an outpatient therapist, it could actually work with them, and they could work together. The robot could provide some of the objective data to help inform that individual's clinical decision making, or it could also help independently. So there's kind of how those two sort of functions. And then as you progress, or as she progresses, and actually I didn't even catch your mom's name, Charlie. Would you mind letting me know? Betsy. Okay. So when Betsy starts to progress and starts to get increased range of motion, have reductions in tone, these sorts of things, it will detect that because it's as evidenced by her changes in her data. So if we detect that she's able to move more, we will qualify that as being a positive change. And then we can make subtle tweaks, right? Very, very small changes in the single digit percentage changes on a day-by-day basis. And those will subtly cause an increase in the sort of challenge. And this is something that Dr. Wolf and I talked about so many times, and it's so important. And it's not just the number of repetitions that you do, it's the fact that those repetitions, those movements have to be what's called sufficiently challenging to actually drive a change. And so that means basically it needs to be hard enough to cause a change in your brain. And so subtly changing those settings, like the ranges of motion, the level of assistance, the complexity of the games, for instance, or the complexity of the tasks that you're asked to do, all of those things will work together to continue to drive a positive change. And those things happen in the background. We don't necessarily want people to know explicitly that something's getting harder, because then it might cause some some anxiety about, oh, it's getting harder. I don't know if I can do this. So
Right.
a lot of the cool bits about this is that it's just in the game, right? You just may have to figure out that you're trying a little bit harder, and that's just because in the background it's getting it is getting a bit harder.
Mhm.
Yeah. So I think your intuition was spot on.